You're sitting down relaxing with your morning paper, a cup of tea in hand, just like any other day. Suddenly, one side of your body goes numb. You can't feel it. You try to speak, but the words won't come out. Your eyes still see clearly, but your mouth won't move. There's no pain, no warning. Just a strange, silent moment when you know something is terribly wrong. As a neurologist, I can tell you without hesitation, this is a stroke. And if you don't act within minutes, what you lose your ability to walk, speak, remember, may never come back. Stroke is a silent thief. It doesn't knock. It doesn't announce itself. But when it strikes, it can take away your normal life in an instant. What makes it so frightening is that it doesn't hurt like a heart attack. It doesn't scream like a broken bone. Instead, it quietly destroys your brain minute by minute, second by second. In this video, I'll show you what really happens inside your brain during a stroke, why it doesn't cause pain but can cause devastating loss, and most importantly, 5 early warning signs you should never ignore. This isn't about fear, it's about being prepared. Because early recognition and fast action, that's how you take control before stroke has a chance to take it from you. First of all, what is a stroke 3? Silent attack. Strategies targeting your brain. A stroke, also known as a cerebrovascular accident, happens when the blood flow to part of the brain is interrupted or significantly reduced, cutting off the oxygen and nutrients that brain tissue needs to survive. Within just minutes, brain cells begin to die, and the damage can be permanent. There are 3 main ways a stroke can attack the brain, and the first and most common is ischemic stroke. In this case, the brain is starved of blood because a vessel becomes blocked, usually by a blood clot. This type accounts for nearly 87% of all strokes. One of the most alarming scenarios is when the attack comes from within, caused by atherosclerosis or plaque buildup inside the arteries. Like silent saboteurs, fatty deposits gradually line the artery walls, narrowing and stiffening them over time. If one of these plaques ruptures, the body reacts as if it's repairing an injury, sending platelets to the site. But instead of healing, it can accidentally form a blood clot that blocks blood flow to the brain entirely. People often ask, is there anything we can do to prevent this? The answer is yes, and it begins with everyday habits. A healthy lifestyle, including a balanced diet, reducing unhealthy fats, regular exercise, not smoking, and keeping blood pressure, blood sugar, and cholesterol under control can significantly reduce your risk. The second attack strategy is embolic stroke, when a stealth agent, a blood clot, forms elsewhere in the body, often in the heart or large arteries, and travels through the bloodstream until it gets lodged in a smaller brain artery, cutting off circulation instantly. One common question is, what kind of heart problems can cause these dangerous clots? The top culprit is atrial fibrillation, a common type of irregular heartbeat. Other risk factors include heart valve disorders, heart failure, and even the recovery phase after a heart attack. That's why detecting and managing underlying heart conditions is a critical line of defense, one that could save your brain from a sudden and devastating stroke. Second, hemorrhagic stroke. A destructive blow from inside your own body. Unlike strokes caused by blockage, a hemorrhagic stroke occurs when a blood vessel in the brain bursts, causing blood to flood into surrounding brain tissue. Instead of nourishing the brain, the blood now becomes destructive, putting pressure on brain cells and damaging them directly. That's why this type of stroke is often more severe and has a higher risk of death. A key question many ask is, why does high blood pressure play such a critical role in this kind of brain hemorrhage? Think of the blood vessels in your brain as delicate, finely tuned pipes. If high blood pressure builds up over time, like overloading an aging plumbing system, the constant strain weakens the vessel walls, causing them to bulge, called an aneurysm, and eventually burst. And it doesn't stop there. Other risk factors like uncontrolled use of blood thinners, clotting disorders, or hidden brain aneurysms also create a ticking time bomb inside your head, and when it bursts, the outcome is often devastating. Third transient ischemic attack. TIA, a warning shot. You must never ignore. A T or mini stroke may seem harmless at first. Symptoms like slurred speech, facial drooping, or arm weakness may disappear within minutes or hours. But that sudden recovery is exactly what makes TIA so dangerous. It creates a false sense of relief. Many patients and families think it must not be serious. In reality, TIA is a critical warning sign of a major stroke that could strike within days or weeks. Statistics show that up to 10 to 15% of people who experience a TIA will have a full-blown stroke within 3 months, and most of those occur within just a few days. That's why every TIA must be treated as a medical emergency. There's no room for complacency. One person shared that their father had a mild TIA, slurred speech, and a weak arm. But since the symptoms went away quickly, the family didn't seek medical care. A month later, he suffered a massive stroke and never fully recovered. Let this be a serious reminder: never underestimate the warning shot of a TIA. Acting early could mean the difference between living well or living with permanent disability. A race against time when every second shapes the brain's future. When a stroke strikes, it's more than just a medical emergency, it's a race for survival. Every minute without treatment, approximately 2 million brain cells die, leaving behind damage that may never be reversed. Within just a few critical hours, your ability to move, speak, remember, or even survive can change forever. That's why early detection and fast action are not optional, they are everything. Getting the person to a stroke-ready hospital immediately is the golden key to stopping long-term damage. BE-FAST, the golden rule for spotting a stroke. FAST. Remember the acronym BE-FAST. It's a simple but powerful tool to help you recognize a stroke within seconds. B. Balance. Sudden loss of balance. Severe dizziness or a staggering walk like they're drunk, even though they were fine moments ago. Eyes. Sudden blurred vision, double vision, or loss of sight in one eye without a clear cause. Chatu F face. Ask the person to smile. One side of the face droops and the smile looks uneven. One arm feels weak or numb. Ask them to raise both arms. If one drifts down or shakes, it's a red flag. S. Speech. Slurred. Speech, jumbled words, or not being able to say a simple sentence clearly. They may not understand you or may not respond correctly. Tea time is brain. If you see any of these signs, call 911 immediately. Don't wait. Don't try to drive them. Early action is the only way to save the brain. A real-life message from someone who's been there. Thanks to remembering the FAST rule, our family recognized the signs early and got my dad to the hospital in time. Because of that, he recovered almost fully with no major complications. Let this be your reminder. Seconds matter. Your awareness, your action, your call can be the reason someone survives a stroke and returns to a full life. Act fast. Get the patient to a stroke center as quickly as possible. If you even suspect a stroke, your one and only goal is to get the person to a specialized stroke center immediately. Don't guess. Don't wait and see. Let the medical team take over. They have the tools, medications, and emergency procedures that can only work if the patient arrives in time. Treatments like clot-busting drugs or emergency procedures can make all the difference, but only if the window hasn't closed. Build your own defense line. Don't let stroke get close. One of the most common questions is, how can I prevent a stroke in the first place? Here's the good news. Up to 80% of strokes are preventable with small, consistent steps you can take every day. Think of it as building a strong personal shield to protect your brain. Control your blood pressure, cholesterol, and blood sugar. Work closely with your doctor and follow their guidance. Maintain a healthy weight. Eat smart. Focus on vegetables, fruits, whole grains. Cut back on salt, sugar, saturated fats, and trans fats. Exercise regularly. Even a daily walk makes a difference. Quit smoking and avoid excessive alcohol. Get regular checkups. Routine screenings can catch warning signs before they become emergencies. These habits are your most powerful defense, your shield against the sudden, devastating strike of a stroke. Don't wait for a warning sign. Start building your protection today. Life after the attack. A journey of strength, challenge, and the will to reclaim your life. Surviving a stroke doesn't mean the fight is over. It means a new chapter begins. After that life-changing moment comes a long, difficult, but hopeful journey toward recovery. It's a path that demands not only extraordinary determination from the survivor, but also steady love and support from family and the expert care of a professional rehabilitation team. Physical therapy helps rebuild strength and balance. Occupational therapy teaches everyday skills again, like dressing, cooking, or walking independently. Speech therapy helps restore the ability to speak, understand, and communicate. And just as important, mental health therapy supports emotional healing, helping stroke survivors overcome fear, depression, and rediscover confidence in their new life. But here's the truth: the best path is to avoid that road altogether by understanding how stroke strikes, recognizing the warning signs, and acting immediately when they appear. That knowledge isn't just life-saving, it's a gift you can give to yourself and to the people you love. So don't stop at reading this, take action. Share this information with friends, family, coworkers, or simply post it online. Sometimes one message can help save a life, and you may never know just how much impact you've had. If you care about protecting your brain and want to learn how to respond to medical emergencies, subscribe to our channel or newsletter. We'll keep you informed with the latest, most practical, easy-to-understand health guidance so you can apply it to your daily life. And if you or someone you love has already been affected by stroke, know this: you are not alone. There are many communities out there ready to listen, share, and encourage you every step of the way. Reach out, because connection can be the most powerful force in recovery. Your health is the most valuable thing you have. Don't wait for the next attack to start caring for it. Start today for a stronger, more active, more confident tomorrow.